My presentation is on dental hygiene in Switzerland. Dental hygiene first was legalized in Switzerland in 1966, and then the first dental hygiene school opened in 1973. For their education, students who want to be dental hygienists must first complete what is called secondary level 2 school, which is similar to high school in the US. And then they also must complete a first aid course before they apply to the dental hygiene school. Right now there are 4 dental hygiene programs in Switzerland with about 70 students who graduate each year from those programs. And they are in school for about 3 years, and during the last year they are doing internships in private dental offices, hospitals, nursing homes, and even clinics, like the free clinics like we have here. And once they graduate, the students are awarded with the Diploma of Dental Hygiene, HF. And the regulatory board in Switzerland is called the Swiss Dental Hygienists, and it's a professional organization of dental hygienists in Switzerland, and it has around 2,100 members right now. They have a regulations committee in the program that assess member violations that go against the professional regulations. And they also provide continuing education courses for current dental hygienists to uphold their license. In Switzerland, in addition to completing procedures to help with gingivitis and periodontitis and treatment and prevention of those diseases, they are also able to disinfect the oral cavity, remove plaque and calculus from both tooth and root surfaces, and they do polish fillings, they do tooth vitality tests, they can administer anesthesia just like we can, and they can also do in-office bleaching treatments. In Switzerland, they have different cantons, which are kind of like the different states in the U.S. And in the canton of Zurich, the dental hygienists can independently run their own practice. And if this is the case, if they choose to do this, then they can't perform all procedures that they've learned, such as like the local anesthesia or surfaces on tooth root surfaces below the gingiva. But if the hygienist works in a practice where there's a dentist, then there aren't any restrictions as long as the dentist agrees to allow the dental hygienist to perform procedures that he or she has learned in school. In my research, I came across a story of a woman who was practicing as a regular dental hygienist in the U.S., and she was looking for another job somewhere outside of the U.S., and so she was constantly checking the classifieds in a magazine called RDH magazine, and she came across a job opportunity in St. Moritz in Switzerland, and she applied for the job, and within 5 weeks she was already in Switzerland, moving into a new apartment by herself and beginning to work at a dental practice in St. Moritz. And the doctor was really nice, and all of her coworkers were super friendly and helpful, and she says in her article that the office was really similar, and practices and procedures were really similar to what she had experienced in the U.S. So the only real challenge that she had was with the language barrier. The main language in St. Moritz is German and Italian, and she had only spoken English. So I think it was a really interesting read, and it gives inspiration to any of us who might be thinking about traveling with our careers. For a dental hygienist who is licensed in the U.S., wanting to practice in Switzerland, they have to have a valid U.S. driver's license, and they have to have at least 1 full year of practicing dental hygiene in the U.S. And they also must be able to obtain a work permit and a visa. So there's not a lot of differences between dental hygiene in the U.S. versus in Switzerland. It just seems like it's a lot smaller. There's only 4 dental hygiene schools, whereas there's a lot in the U.S. right now, and there's a lot of dental hygienists practicing in the U.S., and Switzerland is kind of running short on dental hygienists and are actually recruiting from other countries that dental hygienists are more common at, such as the U.S.